Simon Clarke joins us. He's a cellular microbiologist at the University of Reading. Always a pleasure to hear your expertise, Simon. Abdul Wahab's report says that measles is highly infectious. Does that mean that if I'm in an enclosed space with someone who has measles, I'm definitely going to be infected?
No, not definitely. It just makes it all the more likely. People will be familiar with the concept of an R number from COVID. That spread very quickly with an R number below 5, say about 2, 3, that sort of order of magnitude. For reference, for measles, it's about 12 to 15. So you don't have to be in an enclosed space to pick it up. You could be outside. But similarly, just because you're in an enclosed space doesn't mean you're definitely going to get it. But the chances are reasonably high.
If someone hasn't been vaccinated and they become infected, do they then have immunity for life, or can they be reinfected quickly?
They will have some protective immunity, which will last. It's difficult to say how long it will last for, but well into adulthood, certainly. But that's not to say that it can't wane or drop off, and that you will definitely be protected for the rest of your life. But you'll probably have some good protection, yes.
I'm almost treating you like my local doctor, Simon, because I want to know if it affects adults more than it affects children. I mean, some diseases are like that, aren't they? Depending on what age you are, the effect of the disease can be much worse.
Yeah, we must remember that most adults have encountered this virus. Well, in the UK, they have anyway. So they probably have some degree of protective immunity, but some won't have done. And some will have had immunity that's dropped off over the years. So yes, it can be very unpleasant for adults. If an adult gets it, they're more likely, I think, to be very unwell than a child. Children, although it's unpleasant, it's usually a relatively mild disease, although it can be fatal in children too.
I mean, the WHO does seem to have acknowledged that in the UK there may be slightly bigger problem than elsewhere in Europe. And in the UK, of course, I can't remember how long ago it is, Simon. I think it might be about 20 odd years ago that Andrew Wakefield, the doctor who was struck off the medical register, his research, which was then proven to be false, said that the MMR vaccine, the measles, mumps and rubella vaccine, could lead to autism. Do you know if that's the case in Europe or not? Because presumably that might be one of the reasons that so many children are unvaccinated still in the UK, apart from the fact that we've had the COVID pandemic.
Yeah, that research, which you're right, was done about 20, 25 years ago, has had a big impact on people. You don't need to dissuade many people from getting the measles vaccine to cause a problem, and it's had an effect around the world. I wouldn't want to say in other countries what sort of impact it's had, but in most of the developed world, it's had some sort of impact. But we must also remember that kids going to school now would have normally been expected to have the MMR vaccine before they went to school, and they would have probably had that during COVID, during the pandemic. So their parents were probably a bit less likely to take them to health centres because they were keeping themselves at home and out of what they might have viewed as harm's way for COVID. So that's another reason potentially why it might have been missed.
What sort of advice would you give to people who haven't been vaccinated, and whether they choose to or not in the future? How do they best protect themselves? I mean, would a mask work the way we were doing during COVID?
I think that getting children to wear masks is easier said than done, and really the best way to protect yourself is from the vaccine. You can do things like good hand hygiene, stuff like that. But really, this thing is so infectious that the vaccine is by far the better option. And if people haven't had the vaccine yet, then they ought to speak to their GPs and their health centres about getting it done.
Just very quickly, Simon, they're telling me I need to move on. So just yes or no, does a vaccine protect for life?
We don't know.
Interesting, because I know I had one decades ago. I'll have to look into that. Simon Clarke, thank you so much indeed.
You're welcome.